Hi, I'm Susan Taylor with Scripps Health in San Diego, California. From sun damage to acne scars, wrinkles, and sagging skin, life can take its toll on your appearance. Want a younger, fresher looking you without invasive surgery? Here to talk about cosmetic dermatology is Dr. Rawaa Almukhtar. She is a dermatologist and fellowship trained cosmetic surgeon with the Scripps Clinic Medical Group in San Diego, California. Doctor, thanks so much for being with us.
Thank you, Susan, for having me.
So what causes your skin to age?
That's a good question. It's usually a number of factors, including genetics, sun exposure, and environmental factors all play a role. And we usually lose volume not only in the skin, but in the underlying supporting tissue, so in the fat and the bones as well. And believe it or not, this process starts at the age of 28.
Wow. Okay. And so what happens is you lose volume and thickness in the skin over time.
Correct. You lose collagen and some of the fat underlying the skin, and also on the bone, there is a process of bone resorption or thinning over time.
And what about gravity? The frown lines, the laugh lines, what I like to call the turkey neck.
Yeah, so gravity does play a role in pulling on the skin and on sagging. But not only that, as we move our muscles, those muscles also pull on the skin and can cause some of those wrinkles as well.
So how do you soften or fill in those lines?
We can use injectables like fillers to try to soften and fill those lines. So one syringe of filler is actually 1/5 of a tablespoon. So such a small amount, and we strategically place it in areas where there is a need for more support, like the cheeks or the jawline, or sometimes around the mouth area.
And then what's the downtime after you inject one of these fillers in?
So the beauty of this procedure, it has minimal downtime. Some patients might have swelling or bruising for a few days that can be covered by makeup, but most of my patients actually go to work or kind of resume their day immediately after the treatment.
And so how long does this treatment last, these fillers?
Yeah, that's a great question. So usually based on the type of fillers. So something like hyaluronic acid, which is usually this translucent gel, and it's normally present in our skin. This type of filler can last 6 months to 2 years based on where it's injected and what type exactly you get injected. There are other types of fillers that are biostimulatory. So these types of fillers, they stimulate the body ability to build collagen. So they don't fill by their own, but they stimulate the body to build and volumize the area. And these can last at least 2 years.
And where would you use that? Would that be, around the eyes or in the neck?
So they can be used in different areas. Most common areas are the upper face, the temple area, the cheeks, the jawline. These are some of the most common areas to inject. We can also inject off the face. So some of the areas for the neck sagging, or even the hands are other common areas to inject with these.
And what about these anti-wrinkle injections like Botox?
So for Botox and neurotoxins in general, we use very small needle to kind of inject it. And we use it in different areas of the face. So for example, we use it in the forehead for the forehead lines, between the eyebrows to help with those wrinkles, or around the eyes. Another important area to think about is the lower face, actually. So you have muscles that pull on the lower face and causes some of the jowling. So you want to inject, sometimes as dermatologists, we inject in this area to provide more definition and contour for the jawline and prevent sagging.
And is there any downtime for these Botox injections?
So the beauty about these treatments, there is minimal or no downtime. So some patients might have bruising or minimal swelling after the procedure for a few days, but most of the patients can resume their activities or go to work immediately after.
And how do you make sure that you get a balanced look, not a lopsided look, or that your forehead doesn't appear frozen?
That's why it's important to go to a board-certified dermatologist, someone who's trained in those types of procedures, and someone who's their aesthetic aesthetic kind of taste can align with the patient taste. So knowledge of the injection techniques can help provide a balanced, natural look. And for most of these types of procedure, when they are done in a well manner, it's actually no one can tell what you've been done. You might look better, but no one is able to tell exactly what happened.
And then over time, the skin loses some of the collagen that actually gives the skin volume. So what is microneedling?
So microneedling is the procedure where we have tiny, tiny needles that go underneath the skin and help build collagen and release some of the growth factors. There's actually another treatment called radiofrequency microneedling, where you have energy that's delivered at the tip of those tiny needles that help tighten the skin, stimulate collagen building, and release some growth factors to help build and thicken the skin over time.
And what would you use the microneedling for? What part of the face?
So it can be used on almost any part of the face. It's commonly used for to help with rejuvenation and help with treating wrinkles, but also can be used for other indications like acne scars or loose skin on the neck area.
Sign me up for that. And what's the downtime and how long does the microneedling last?
So some of the microneedling procedures can take 3 months to take full effect, as they can immediately help with skin tightening, but again, stimulate the own body ability to build and heal itself. So, and in terms of the downtime with these types of procedures, minimal downtime. It might have a social downtime of a few days because of the swelling or any bruising, but no actual downtime. Some of patients do get the treatment done and proceed with their day as planned.
So who is a candidate for these cosmetic treatments?
So most of the patients who are looking to use some of those tools for rejuvenation would be good candidates for this treatment. A lot of the patients start once they hit their 30s or even in their 40s, they start getting some of those treatments.
And what about acne scars?
So acne is usually a problem of teenagers, and thus acne scars, we see it in the late teenager years or early 20s. So some of the patients elect to start some of those procedures at that age.
Are there any side effects to these treatments?
Most of the side effects are minimal and well tolerated, like swelling, bruising, but it's always important to go to a board certified dermatologist, someone who's trained in these procedures, so they know how to manage any problems that can happen and prevent them as possible.
Are there any folks who should not have these cosmetic dermatology treatments?
Yes, for example, if there is an active infection in the area we're treating, we'd rather clear the infection first before treating.
And what if you've had skin cancer?
So skin cancer by itself is not a problem for some of those treatments. However, if you had a treatment for a skin cancer recently, you'd rather that heal before getting any of those injections.
Any final thoughts, doctor?
I would say that there is evidence-based medicine behind the science of rejuvenation, and we have plenty of tools to help our patients. So if you have a question about that, I encourage you to see a board-certified dermatologist who can help you address those needs and help you age gracefully.
Doctor, thanks so much for taking the time. We appreciate you being with us.
Thank you for having me, Suzanne.
Sure. If you want more information on how to make your skin look younger with these injectables, this cosmetic dermatology, just click on the link or go to scripps.org/videos. Want more critical information about your health? Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. At Scripps, we're here for good. I'm Susan Taylor. Thanks for joining us.